Welcome back to Neurovascular-Nuggets, everyone. I'm Prof. Osama, and with me as always is Salma, ready to dissect another critical piece of research in the neurovascular world. Today, we're tackling a really important and often clinically challenging scenario, those unruptured internal carotid artery aneurysms that, despite not having ruptured, cause significant problems by pressing on adjacent nerves, leading to visual disturbances or eye movement issues. We're going to dive deep into a systematic review and meta-analysis specifically on the role of flow diversion for these complex cases.
Thanks, Professor Sama. It's such a crucial topic, isn't it? Because while the immediate threat of a rupture might not be there, the impact of these compressive aneurysms on a patient's life can be absolutely devastating. Imagine losing your vision or experiencing constant double vision. These aren't just minor inconveniences, they can severely impair daily activities, work, and overall quality of life. So understanding the effectiveness and safety of our treatment options, particularly with newer technologies like flow diverters, is paramount. What's the specific paper we're dissecting today, and what was its scope?
Exactly, Salma. The paper we're discussing is a comprehensive systematic review and meta-analysis that meticulously gathered data on flow diversion specifically for compressive unruptured ICA aneurysms presenting with those challenging neuro-ophthalmological symptoms. They managed to include 22 studies, which collectively involved a substantial cohort of 594 patients. All of these patients were treated with flow diverters for this particular indication. This kind of robust, pooled data is incredibly valuable for us clinicians who are constantly trying to make the most informed decisions for our patients.
Wow, 594 patients across 22 different studies. That's a truly significant body of evidence, giving us a broad picture. So let's cut to the chase, Prof. Osama. What did this extensive review find regarding the ultimate goal here? Symptom recovery. For patients suffering from these visual or oculomotor issues, how effective is flow diversion in actually getting those symptoms to improve, or even better, completely resolve?
That's precisely the key question everyone wants answered, Salma. And the results are, I think, quite encouraging and provide strong grounds for optimism. The pooled rate for complete symptom recovery across all these patients was 47.4%. So almost half the patients saw their symptoms completely disappear. And if we broaden that to include those who experienced at least an improvement in their symptoms, meaning their condition got significantly better, even if not entirely resolved, that number jumps substantially to 74.5%. So nearly 3/4 of patients experienced some form of clinical benefit, which, for such complex and often debilitating issues, is a fantastic outcome.
That's truly fantastic, Prof. Osama. To have almost half of patients achieve complete recovery and 3/4 see significant improvement, that's a substantial impact on their daily lives. For patients struggling with vision problems or debilitating double vision, hearing those numbers must offer a tremendous sense of hope. It really underscores the potential for a return to normalcy. But I'm curious, did the study differentiate between types of symptoms? Do visual symptoms, for instance, respond differently to oculomotor ones involving eye movement?
They absolutely did, and it's a very important distinction that directly impacts how we counsel our patients. For those presenting primarily with isolated visual symptoms, things like vision loss, blurred vision, or visual field defects, the complete recovery rate was 30.6% and an improvement was noted in 56.6%. Now, if we compare that to patients with isolated oculomotor symptoms, which involve issues like double vision, ptosis, or difficulty moving the eye, the numbers are even better. A complete recovery rate of 47.8% and improvement in an impressive 78%. So yes, it appears that oculomotor symptoms tend to respond more favorably, achieving higher rates of both complete resolution and overall improvement, which is a valuable piece of information for prognosis.
That's a really critical nuance, providing a more granular understanding of patient outcomes. So if a patient comes in with an aneurysm causing, say, persistent diplopia, we might be able to offer them a slightly more optimistic outlook on symptom recovery compared to someone experiencing significant established visual field loss. It really helps us in managing patient expectations during those often difficult consultations, doesn't it? Beyond the symptoms, what about the aneurysm itself? What were the rates of complete aneurysm occlusion with flow diversion?
Absolutely, Salma. Managing expectations is key, and regarding the aneurysm itself, the primary mechanism of flow diversion is to redirect blood flow away from the aneurysm sac, promoting thrombosis and eventual occlusion. This meta-analysis reported a complete aneurysm occlusion rate of 68.6%, so a little over 2/3 of these compressive aneurysms were successfully obliterated. This figure is quite consistent with what we generally observe with flow diversion for other types of intracranial aneurysms, which reinforces the technique's efficacy in achieving its mechanical goal.
Okay, so we're seeing good occlusion rates for the aneurysm and encouraging symptom recovery, particularly for oculomotor issues. That's a strong positive. However, with any neurovascular intervention, especially one involving brain arteries, there are always inherent risks. What did the study reveal regarding complications, both transient and more permanent, and what were the overall morbidity and mortality rates?
That's a profoundly important aspect of our discussion, Salma, because weighing benefits against risks is fundamental to ethical clinical practice. The study reported a rate of transient worsening of symptoms at 7.1%. This means that for a subset of patients, their symptoms might temporarily get a little worse shortly after the procedure before hopefully improving again. More critically, permanent worsening was observed in 4.9% of patients, which is a significant outcome that we must discuss openly. Beyond symptom-specific issues, the overall morbidity rate, meaning any complication that resulted in some degree of disability or adverse event, was 5%, and sadly, the mortality rate associated with the procedure was 3.9%.
Those morbidity and mortality figures, along with the rates of permanent symptom worsening, are obviously very serious considerations. How do these numbers compare to other established treatments that we use for similar types of compressive aneurysms? Are flow diverters offering a comparable safety profile, or are we pushing the envelope with potentially higher risks, perhaps in exchange for better efficacy?
That's an excellent question, and it's precisely what the authors of the meta-analysis explored. They found that the symptom recovery rates, both complete and improved outcomes, are quite comparable to what we've seen in previous meta-analyses on surgical clipping, endovascular coiling, and even parent vessel occlusion for these kinds of compressive aneurysms. So from the perspective of getting the patient better symptomatically, flow diversion appears to be very much on par with these established, more traditional techniques. This offers solid reassurance about its therapeutic potential.
That's a pretty strong vote of confidence for flow diversion then, suggesting it can achieve similar therapeutic outcomes to older or more invasive methods. But what about the complication rates? Are those also comparable, or is there a noticeable difference when stacking flow diversion against, say, surgical clipping or even coiling?
This is where we encounter a bit more nuance, Salma. The morbidity and mortality rates reported in this study, while generally acceptable for complex neurovascular procedures, were found to be slightly higher than those observed in some specific previous studies, such as the PUUFS trial. The PUUFS trial, for context, focused on the pipeline flex embolization device for a broader range of unruptured aneurysms. It's important to remember that direct apples-to-apples comparisons can be challenging due to differences in patient populations, aneurysm characteristics, and surgical nuances. Compressive aneurysms often present unique anatomical challenges and critical nearby structures which might inherently elevate risk. However, it's a detail we must acknowledge and factor into our risk-benefit discussions with patients. Regarding occlusion rates, they generally align well with what we've come to expect from flow diverters in other indications.
So, comparable symptom recovery and occlusion, but a slight elevation in risk compared to some flow diverter studies, perhaps attributable to the inherent complexity of these specific compressive aneurysms. It definitely sounds like a delicate balance of risks and rewards. But Prof. Osama, you always bring us that special nugget of gold, a key take-home message from every paper. Was there one standout finding in the study that really resonated with you, or that you think is a game changer for our practice?
Oh, absolutely, Salma. There's always a nugget. And for this study, it's a truly critical one that I believe should not only solidify but perhaps even dramatically shift our approach to these cases. The study emphatically emphasizes the crucial importance of early treatment. And when they say early, they're talking about intervention within 1 month of symptom onset. This isn't just a minor recommendation. They found that if these aneurysms are treated within that critical, relatively short window, the chances of symptom recovery are improved tenfold. Let that sink in. A tenfold improvement.
Tenfold? Prof. Osama, that's not just a marginal gain or a slight statistical advantage. That's a monumental life-altering difference. You're telling me that if a patient comes in with, let's say, acute onset double vision or a noticeable visual deficit caused by a compressive ICA aneurysm, and we manage to treat them within a month versus waiting longer, their likelihood of getting better is 10 times higher? That's an absolutely astounding finding and incredibly powerful information for every clinician.
Precisely that, Salma. Imagine the implications for our clinical pathways and urgency protocols. It means that rapid diagnosis, immediate referral to neurovascular specialists, and swift treatment planning are not just good practice but are absolutely paramount to achieving optimal outcomes for these patients. A patient presenting with acute or subacute neuro-ophthalmological symptoms that point towards an ICA aneurysm compression needs to be investigated with the highest priority. Getting them to treatment within that golden month could very well be the difference between a near-complete recovery and persistent, potentially permanent neurological or visual deficits. It unequivocally underscores the critical urgency that sometimes isn't fully appreciated for unruptured aneurysms, particularly when they're symptomatic due to compression.
That's a colossal takeaway. It totally shifts the paradigm from this is an unruptured aneurysm, we have some time, to this is a symptomatic compressive aneurysm and time is of the essence. This isn't like some incidentally found unruptured aneurysms where we might have the luxury of observing for a few months or even longer. For these symptomatic ones, based on this data, every day counts, every week matters. How does this incredibly significant finding translate into practical applications for clinicians on the front lines, from neurologists to ophthalmologists to neurosurgeons and interventionalists?
Well, first and foremost, it provides exceptionally strong evidence for flow diversion as a truly valid, effective, and often preferred treatment option for these specific compressive ICA aneurysms. Before this comprehensive meta-analysis, while we certainly used flow diverters for this indication, having this level of pooled, robust data gives us much stronger scientific footing to lean on. It profoundly informs our clinical decision-making process, helping us to more confidently select appropriate patients for flow diversion and justify that choice to colleagues and patients alike.
So it effectively solidifies flow diversion's rightful place in the treatment armamentarium for these particular cases. And I can only imagine how incredibly useful this information, especially the importance of early intervention, must be for patient counseling. Being able to cite these recovery rates and, crucially, explain the tenfold benefit of acting quickly must make those often tough, emotionally charged conversations with patients and their families a little clearer and more hopeful.
Precisely, Salma. That kind of transparency and data-backed prognosis builds immense trust. We can tell them, look, we're actively aiming for complete symptom recovery, and almost half of all patients achieve that, and nearly 3/4 will see significant improvement. And then, the vital part, but to truly maximize your personal chances for the best possible outcome, we need to act quickly, ideally within this first month. This study also adds a comprehensive and much-needed analysis to the existing literature, which is always invaluable for a rapidly evolving and highly specialized field like neurovascular medicine.
It certainly sounds like the study fills some really important knowledge gaps and provides actionable insights. What about for younger residents or fellows who are just starting their journey in neurovascular medicine? How does this paper fundamentally change their approach or understanding of these types of aneurysms and their management?
For them, Salma, it's a foundational piece of knowledge that should be ingrained early. It teaches them that while flow diversion is an incredibly powerful and versatile tool, its efficacy and optimal outcomes aren't uniform across all scenarios. Patient selection and, critically, the timing of intervention are paramount. They learn that for these specific compressive aneurysms, that early treatment window isn't just better, it's literally 10 times better. It emphasizes the absolute necessity for a seamless, multidisciplinary approach, neuro-ophthalmologists, neurologists, neurosurgeons, and interventional neuroradiologists working in perfect concert to get these patients diagnosed accurately and treated swiftly. This collaborative urgency can genuinely alter a patient's life trajectory.
That makes perfect sense. It's a powerful testament to the complexity of neurovascular care and how profoundly even unruptured aneurysms can impact a patient's life if not managed with precision and urgency. What would you say is the single biggest, most impactful take-home message for all our listeners from this entire fascinating discussion?
The biggest take-home, Salma, without a shadow of a doubt, is the transformative power of early intervention for these specific cases. For unruptured ICA aneurysms causing neuro-ophthalmological symptoms, flow diversion is indeed a very effective treatment comparable to other modalities in terms of both symptom resolution and aneurysm occlusion. But if you truly want to give your patient the absolute best possible chance of regaining their vision or eye movement without persistent, debilitating deficits, you must treat them within that first month of symptom onset. The data is clear. The difference in recovery likelihood is truly astounding, a tenfold improvement. This should drive our clinical urgency.
Tenfold improvement. That's a message that absolutely needs to be widely disseminated across all specialties that might encounter these patients. That's a genuine game changer for patient prognosis and clinical guidelines. Thank you so much, Prof. Osama, for meticulously breaking down this incredibly important meta-analysis for us. It truly gives clinicians solid evidence-based ground to stand on when navigating these challenging and time-sensitive cases.
My absolute pleasure, Salma. It's through rigorous studies like these that we genuinely advance our field and consistently improve patient care. And for all our dedicated listeners, remember, you can always find more in-depth details and the full article by searching for Neurovascular-Nuggets or by following the link we've provided with this episode. Always keep learning, always strive for those best possible outcomes for your patients, and always remember the critical role of timing.
Absolutely. That wraps up another insightful episode of Neurovascular Nuggets. Join us next time for more deep dives and critical analyses into the dynamic world of neurovascular medicine. Take care, everyone, and stay curious.
Goodbye for now.